Hello, you're listening to Navigating Cancer Together. I am your host, Talaya Dendy. If you are new to the show, thank you so much for joining for the first time, and I hope you listen again. For the valued listeners who are returning, the members of the Navigating Cancer Together community, thank you so much for joining me again, and I'm so honored that you continue to be a part of this community. Navigating Cancer Together is the show that has something for everyone facing cancer. Why? Because everyone is different with different needs, beliefs, and perspectives. Thank you so much for joining me for this episode. I encourage you to open your minds and your hearts. As I always say, Navigating Cancer Together is everywhere. Make sure to subscribe and follow the show to stay updated on our latest episodes. You can listen on Spotify, Apple Podcasts, YouTube, or your preferred podcast app or platform. Today, I have a really personal story to share with you all, and I think it's really important to share because it just shines a light on, again, the importance of self-advocacy. I know I talk about it a lot, but it is really a life-saving tool. Before we get into that, I want to share a comment about an episode that I released on August 6th, and that episode is all about healing through forgiveness. And I had a phenomenal guest join me, Catherine Giovanni. I want to share a comment that a listener left on LinkedIn under a post for this episode. Shara Ruffin commented, Catherine's take on forgiveness really hit home. It's not about letting others off the hook. It's about freeing yourself. Shara, I could not agree more. It is about freeing yourself and finding that peace and joy in your life. Forgiving others is a way to free yourself from resentment, anger, and bitterness, because that doesn't help any of us, especially on our healing journeys. Shara, thank you so much for your comment. Thank you so much for engaging with that episode and navigating cancer together. I appreciate you and thank you for being a valued listener. For anyone facing a health challenge, whether you're newly diagnosed, whether you're in active treatment, or navigating life after cancer, a very common question often arises: am I doing everything I can to get the best care? And honestly, sometimes we don't know what that is, especially if we are new to the healthcare system and being a healthcare consumer. Am I doing everything I can to get the best care? Or is this new ache, this new symptom, something that I should pay attention to or be concerned about? We've all had those thoughts. We've all blown off things that we think are just small. You know, it's just a little ache, it's just a pain, and it's not that big of a deal. When you really think about it, and you're questioning if you should pay attention to those aches, those pains, those feelings are internal nudges, and they're very common. Those thoughts are internal nudges that say, hey, maybe you should go a little bit further. Maybe you should ask a few more questions. Today, I'm going to talk about listening to that inner voice, navigating the healthcare system, and the power of self-advocacy. I have a new story to share, and I think it may be very relatable to a lot of you out there listening. My experience with Hodgkin's lymphoma and cancer treatment has taught me invaluable lessons about paying attention to my body and speaking up. And sometimes those lessons come when you least expect them, even years down the road. As a reminder, I am 14 years out from being diagnosed with Hodgkin's lymphoma, and things are still coming up 14 years later. The core topic today is advocacy, but not just advocacy in general. I'm talking about hardcore self-advocacy, especially within the healthcare system, and particularly as patients and survivors. It's about being your own best champion, ensuring your needs are not just heard, but truly met. For us, this isn't just a nice to have. It's absolutely crucial for ongoing health and peace of mind. Why is it so vital for patients, whether you're managing a new diagnosis or living with a complex medical history? Because your body, your history, and your feelings are unique. That's why. Healthcare providers oftentimes do their best, but they are not experts on you. You carry experiences, stories, traumas, insights that are really invaluable. We've often learned the hard way that the early attention to a concern can make a significant difference. And I learned that the hard way. For those of you who are not familiar with my story, I went into the doctor and was concerned about a lump. I pointed a lump out on my neck during a physical exam, and it was blown off pretty much as nothing to worry about. Long story short, a year later, I was diagnosed with stage 3 Hodgkin's lymphoma. So I learned the hard way that early attention to a concern can make a significant difference. I am a walking lesson. I am a walking testimony to the power of self-advocacy and speaking up. Although it was a year, things still worked out in my favor, but it's a year that possibly added more treatment to what I already needed or more time to my treatment. I've shared that story a number of times, so I'm not going to really get into it here because I have something new to share, but just wanted to give a quick summary for those who are new to navigating cancer together and new to my story. But again, I learned the hard way to pay attention to a concern and the difference that it can make. And sometimes the very act of speaking up can transform anxiety into action and clarity. I want to share a recent personal experience that truly emphasized all of this for me once again. It was around Mother's Day. I started experiencing a persistent pain and soreness in my right breast. Naturally, the first thing I did was a self-exam. And thankfully, I did not find any lumps. And just to show you how things work, I even had my annual mammogram already scheduled for July of this year. As I pointed out, all of this started in May of this year, so July was only a couple months away. The logical side of my brain said no lump, appointment scheduled, probably nothing. But then there was this other voice. Talaya from 2011 spoke up and said, "We're not waiting." This is where a patient's unique perspective comes into play. My history of Hodgkin's lymphoma, especially the chest radiation I received, weighed heavily on me as well. Some of you may not know, but for me, I know this very well because it's important for me to know these things. But chest radiation increases the risk of breast cancer later in life. This is something documented in my survivorship care plan, and that's abbreviated as SCP. It's documented as something to keep my eye on and to stay on top of mammograms. A survivorship care plan, or SCP, is a detailed plan given to patients after treatment ends. But really, to be honest, this is something you want to start talking about with your doctor, your oncologist, your healthcare team before your treatment ends, just to make sure that it's ready for you when your treatment is over. This plan contains a summary of a patient's treatment along with recommendations for follow-up care and long-term follow-up care. It has been a helpful tool for me when coordinating care between doctors. I highly recommend, if you don't have a survivorship care plan, that you request one from your oncologist or clinic or hospital where you receive treatment. Now, back to my story. I have a lot to share, so just stay with me. That knowledge, that personal risk factor changed everything. I wasn't willing to wait, and I didn't care what anyone thought. The potential threat felt very real for me, despite the lack of typical signs. And for anyone out there listening, any patient of any kind, your history matters. Stay on top of your history. Document your history. Have it electronically, utilize your electronic health records, whatever works for you in terms of keeping track of your health history, keep track of it because it will come in handy. So despite no lump and a future appointment, I decided to contact my primary care doctor immediately. This wasn't about being alarmist. It was about honoring my body's signals and personal risk profile. It felt daunting, almost like I was bothering them for what might be nothing, but the thought of not acting felt worse. Thankfully for me, making an appointment was seamless. They were able to get me in within a few days, which ended up being at the beginning of the very next week. During my appointment, my doctor was thorough. She asked many questions about the nature of the pain, its duration, even my typical bra wear and menstrual cycle. All of these are very important and valid questions in helping to get to a root cause or get an idea of what might be going on. After she performed a breast exam, she didn't feel any lumps either. Thankfully, that's a great sign. Initially, she reassured me that breast cancer isn't typically associated with pain, and she suggested it might be hormonal. This is a common and often accurate assessment. My experience with my first diagnosis taught me a vital lesson. You have to overly share details, concerns, and advocate until you have a plan that you are comfortable with and you have the answers and clarity you need. Here is another example of practicing advocacy. I reminded her of my prior history of cancer and the radiation to my chest area. She asked me how I wanted to proceed. I explained that while I understood her initial assessment, and although it was reassuring given my specific history, an earlier mammogram and an ultrasound was an additional precaution that would bring me significant peace of mind. She listened and immediately agreed that an earlier mammogram and ultrasound were warranted. It wasn't about distrust. It was about collaborating on my specific health factors and doing what I needed to do for me. This moment is often the hardest part of advocacy, pushing past the initial no or it's probably nothing. No one wants to be viewed as a hypochondriac. It requires confidence in your own knowledge and intuition about your body and your unique history. And it's okay to educate your healthcare provider about specific context as a survivor, especially if your doctor has not been with you from the beginning of your cancer journey. And this particular doctor had not been with me since the beginning of my cancer journey in 2011. So, of course, there was a need to educate, to remind that, hey, I've had this significant health experience. Doctors see a lot of patients, so don't wait for them to ask. Sometimes we have to help connect the dots. Be a connector for your own health, for your own well-being. So after the breast exam by the doctor, after the conversation, my doctor quickly placed orders for both exams, the ultrasound and then also the mammogram. This was a huge moment of validation for me, confirming that listening to my gut and speaking up was the right thing to do. What was even more reassuring was the support I received from everyone on the healthcare team, my doctor, the physician assistant, the mammogram technician, and radiologist. They all expressed that I was doing the right thing by advocating for myself and my needs. This positive reinforcement is so important and can empower you for future interactions. If no one is cheering you on, if no one is validating how you feel, you don't need that anyway. You know what's going on with you better than anyone. Your body's talking to you. Your body's telling you something. Listen. Thankfully, there wasn't much of a waiting game. I started with a mammogram first and had results the very next day. Immediately after the ultrasound was completed on my right breast, I was told there were no signs of cancer. And there were no changes from my mammogram results from last year. That is another win. That is another win. I will admit that the time between the exams felt long. Although they were done on the same day, back to back, the waiting period felt long to me because when you're waiting for those test results, I don't know, it's just something about anxiety it just creeps up. So, of course, I started doing my breathing exercises while waiting to get my ultrasound done. And this is where managing and working through anxiety become a form of self-advocacy too. You can do this through mindfulness, deep breath, and the positive experience that I had up to that point. Focus on the things that are going well. So mindfulness, deep breathing, focusing on the wins that I had received up to that point. That really helped me to ease anxiety. I focused on the fact that I had taken specific action and that was in my control. So I had taken action and that is all that I could do and speak up for myself. So I was doing the things that I could do. That was reassuring as well. You might be wondering, what was the explanation for the pain I was experiencing in my breast? It turns out that hormonal fluctuations, particularly in estrogen and progesterone levels, they're a common cause of breast pain, especially during periods, pregnancy, and menopause. These hormones can cause breast tissue to swell and retain fluid, which can lead to tenderness and pain. So honestly, it was a false alarm from a cancer perspective, but a very real signal from my body. Therefore, it was a valid alarm, signaling that my gut, my body, and my self-advocacy skills are all in tune. This entire experience reinforced something very important for me, and that's trusting your instincts as a patient and survivor and being your own best advocate. It's always better to investigate a concern than to worry endlessly, or worse, potentially delay a diagnosis. I've been there, done that, not doing it again. This whisper of, what if it comes back, can be transformed into action. But advocacy just isn't about words you say to your doctor or the questions you ask. There are powerful internal ways to advocate for yourself that we often overlook, but they are crucial to your peace of mind and resilience. The first thing you can do is validate your own experience. I believe this is the most important. As patients, we sometimes feel our concerns are minimized or questioned. Remember, your feelings, your pain, your history, your needs, they are all valid because they are yours. You don't need external validation to believe in your own truth. Acknowledge your feelings without judgment. That's a powerful act of self-advocacy. The second is to try to reframe problems into information. Instead of seeing a new ache or a challenging situation just as a problem to fix, try to view it as information your body or life is giving you. This subtle shift from fear to curiosity can reduce anxiety and equip you to approach challenges with a clearer mind, seeking answers rather than just dreading the outcome. The third, or number 3, set internal boundaries. We often think about setting boundaries with others, but what about within ourselves? This means deciding what thoughts you allow to dominate your mind, what emotional burdens you carry, and what external pressures you internalize. It's not about faking positivity or pretending to have it all together. It's about protecting your inner peace and mental space from unnecessary overwhelm. We can all use that. And then finally, visualize your best self-advocate. Take a moment to imagine yourself confidently expressing your needs, feeling truly heard, and receiving the care you deserve. What does that feel like? What does that look like? This mental rehearsal can build confidence and prepare you for actual advocacy moments. You can do it. You are that self-advocate. Your unique medical history is a powerful piece of information. Don't be afraid to share it, to emphasize it, and to ask how it impacts your current situation. You are the expert on your body and your experience. So my message for you is this: your health is worth it. Please do not hesitate to ask questions, seek clarification, and if necessary, demand the care and attention you deserve. You are not bothering anyone when you advocate for your well-being. You are taking responsibility for your health journey. Think about it. What's one small step you can take today to advocate for your health? Is it making that call you've been putting off? Is it preparing questions for your next appointment? Is it simply giving yourself permission to listen to that inner voice? Remember, your voice is powerful. Use it. I hope that you have found my story helpful. I hope that it has encouraged you in some way to really just step up, make that appointment that you've been putting off, to address that concern, that ache, that pain, that lingering feeling that you're having about something going on with your health. Go get it checked out. Like in my case, it might be nothing, but it's never a false alarm. It's a valid alarm because our bodies are always telling us something. Thankfully, my diagnosis was not breast cancer, but I did learn something. I did learn that the hormonal changes in my body may be creating aches and pains. And I've learned about different things that I can do to offset or address those aches and pains in natural ways. So never feel like, even if you go in and it's nothing, at least you took care of yourself. At least you showed up for yourself. And I believe that the more practice we get with self-advocacy, the better we get. So it's never a false alarm. It's a learning lesson. It's a valid alarm. It's practice on speaking up. Never feel bad about taking care of you. Thank you for joining me for this episode of Navigating Cancer Together. I hope my story has resonated with you and encouraged you to continue your own advocacy journey. If you found this episode helpful, please share it with someone who might benefit from it. Keep listening to your body and keep advocating for yourself. There is something really exciting that is in the works. It's something that really focuses on survivorship. And it's something that is another area where we have more to talk about. Beyond the cancer treatment, we have more to talk about. A dear friend of mine participated in the special events that I did for National Cancer Survivor Month. I did the podcast, What's at the Heart of Survivorship. Also, I had the panel discussion. You can find all of those episodes on Navigating Cancer Together, as well as the On the Other Side YouTube channel. But a dear friend of mine saw the passion and saw the work that I was putting into these specials for National Cancer Survivor Month. And he said, Talaya, you have something there. That was the first sign. The second sign was the powerful and positive feedback that I received from people who listened to the episode, as well as attended the live panel discussion. I am excited to share that I am working on the Survivor series with Talaya Dendy. Keep an eye and ear out for that. Before I end, I would like to give a shout out to the Navigating Cancer Together community and valued listeners. Thank you so much for joining me today. That is it for this Wednesday. And until next time, let's keep navigating cancer together. Take care.